From my very, very young years, I did ballet, I did tap, I did jazz type dancing. I've been a biker for a long, period of my life, and one of the trips that was just an amazing trip to me was traveling throughout South Africa. So a lot of the athletic activity really started to affect my knee. Normally I was teaching spin classes about 3 days a week. Eventually I had to give that up. I was only teaching 1 class a week, and I wasn't even doing prep time unless I needed to. I thought, oh boy, this is like a death sentence of not being able to exercise, continue spinning, and do all the things I did, and I was very, very concerned about that.
Norma presented to me with a fairly typical presentation of knee arthritis. There was pain in the knee that was fairly constant, and the pain was gradually eroding her function. And when Norma's quality of life was affected significantly, she started seeking treatment.
I live in Washington, D.C., and I scheduled surgery with a very well-known doctor there. But someone mentioned Dr. Sheldon, and I came there, and not only did he give me sort of a different diagnosis, he made me feel so comfortable that he understood exactly what was going on in my knee.
My model for practice is what we call shared decision making. So when a person comes in with knee arthritis, I don't tell them that they need a knee replacement. My job is to educate them on what the condition is, how it can affect their day-to-day life, and what the treatment options are.
It was not, I'm the doctor, you're the patient, this is what you do. It was collaborative, and I left there thinking no one else could do that surgery. As a matter of fact, before I left, I went right to the nurse and said, let's schedule the surgery.
Knee replacement surgery has been one of the most amazing and effective advances in orthopedic surgery over the past 40 years. It's amazing to see a person essentially limping into the office, and then after a knee replacement surgery, see them back to all of their normal daily activities.
I wake up after the surgery, a couple hours later, get back to my room, and the first thing the nurse said was, as soon as you're out of anesthesia, we're going to walk the runway. I had no idea what that meant. It was incredible. I was like, I just had a total knee replacement and I'm walking, and it was amazing. They wanted to make sure that I recovered in enough time to get back to the things I wanted to do relatively quickly. So when you consider I had surgery in November and I was back teaching spin classes in February, that is amazing.
It doesn't surprise me that she's gotten back to instructing spin classes. She was very motivated to recover that level of activity to which she was accustomed.
Any type of surgery is scary, but if you think about what it's going to be like on the other side, let me assure you that it is so much better to be pain-free. I was living with that pain, and I thought that that pain would have to be a part of my life, but that desire to get better and getting to the other side, that's where you want to be. I really live from a place of gratitude. I am so glad that I did this surgery.